Hello, this is Drew Preston with Nebraska Medicaid. Today's presentation will cover the basics of Heritage Health Adult, Nebraska's Medicaid expansion program. To begin our discussion today, we'll begin with some background information on expansion. Beginning in fall 2020, Nebraska is extending Medicaid coverage to adults between the ages of 19 and 64 who earn up to 138% of the federal poverty level. This is an annual income of about $17,000 for a single person living alone. We'll provide a few more income examples on the next slide. The difference between adults who have been on Medicaid in the past compared to this new group of adults is that adults in the past either had to have kids or dependents or have other different types of health needs, such as a disability. Throughout this presentation, you'll see the term Heritage Health Adult, or HHA for short. This is the name of the program Nebraska Medicaid has built for Medicaid expansion, so you may sometimes hear both terms used. Heritage Health Adult, as you can tell from the name, builds on top of the current managed care program for Medicaid beneficiaries called Heritage Health. Medicaid expansion is adding another group of adults to Heritage Health. This slide provides a few more examples on the income guidelines for Medicaid expansion. As you can see, the income limit is adjusted for larger households. As an example, for a childless couple living together, the annual income limit would be slightly over $23,000 per year for the household. For a family of four, maybe two parents and two kids, the income limit would be slightly over $36,000 per year. These figures are tied to the 2020 federal poverty level, so these numbers will be adjusted in 2021. But the percentage of the federal poverty level will remain the same. People can apply for expanded Medicaid at any time. Benefits for those who are eligible for expanded Medicaid will begin on October 1st of 2020. There are a number of options for people to apply for Medicaid. We would encourage those interested in applying to apply online or over the phone. People can also visit a DHHS local office to apply as well. Paper applications are also an option, which can be downloaded from Access Nebraska, requested over the phone, or picked up at a local office. Completed applications can be returned to DHHS via email, phone, or fax. We would like to stress that there is not a separate application for expanded Medicaid. It is the same single Medicaid application that people may be familiar with from the past. If you have questions on the application process, Access Nebraska or local office staff can assist you with some help. After someone applies for Medicaid, DHHS will notify the applicant whether they are eligible. If they are not eligible for Medicaid, a few things can happen depending on their circumstances. DHHS may inform them of other programs they're eligible for, such as SNAP or food stamps. Particularly for folks who are slightly over income, the Medicaid application will then be sent to healthcare.gov for consideration for coverage there. As with everyone who applies for Medicaid, people who are denied eligibility can appeal DHHS's decision if they believe the department made a mistake. They can contact us to request a state fair hearing to begin the appeals process. If someone is found eligible for expansion, they will receive a notice from DHHS explaining that they are eligible and what benefits they will receive. On this slide is an example of what these notices look like in case you are working with someone who is applying for Medicaid and providing them assistance with this process. Moving forward, we will discuss some of the basic eligibility criteria Medicaid looks at for the expansion group and some of the very next steps that happens once someone is determined to be eligible. For the expansion group, Medicaid is only looking at basic eligibility criteria like age, 19 to 64, income, at or below 138% of the federal poverty level, and residency and citizenship, which means that they are a Nebraska resident and U.S. citizen or otherwise lawful permanent resident. Once someone is enrolled in HHA, they can be reassessed each year for eligibility without needing to send DHHS a new application. DHHS will begin these renewals automatically and let the individual know if they need to provide any updated details. They will keep their coverage as long as they remain eligible. However, if the individual has some life circumstances change, like maybe a raise at work or a new residential address, they will need to let DHHS know of that change within 10 days of it occurring. When they provide these updates, DHHS staff will review their case to make sure they are still eligible for Medicaid. There will be two benefit packages available through Heritage Health Adult, Basic and Prime benefits. Basic benefits include a variety of medical, behavioral health, and prescription drug benefits. Prime includes everything covered in Basic, plus dental, vision, and over-the-counter drug coverage. When expansion launches in October, Prime benefits will be limited to pregnant women, adults ages 19 and 20, and those deemed medically frail by DHHS. Everyone else in this group will receive basic benefits. On the next two slides, we'll discuss that with expanded Medicaid being an option for health coverage for some Nebraskans, some people may experience some changes in their DHHS benefits or other types of health coverage. First, we'll discuss people who currently have Medicaid. Some adults currently on Medicaid may be transferred to HHA and will be notified by DHHS of any changes to eligibility or benefits. This would be because they fit more appropriately in the expansion group than their current eligibility group. This transfer will be automatic and will not require that person to take any action. It is worth noting that even if someone is transferred into the HHA group, they will not experience a change in benefits while the COVID-19 public health emergency is in effect. There will also be some individuals with other DHHS benefits, such as SNAP or energy assistance, who may qualify for Medicaid. But just because they're in the DHHS system for these benefits doesn't necessarily mean we have all of the information needed to make an eligibility decision for Medicaid. So, if interested in HHA, these people will need to submit a Medicaid application. On this slide, we move along to people with other types of health coverage. There are people with both coverage through the federal marketplace, healthcare.gov, and through their employer who may qualify for HHA. These people will need to submit an application to be considered, and if found eligible, let their current insurance carrier know so they can make any needed updates. Moving on to our next topic, many people may be wondering how people in the Heritage Health Adult program will use their benefits. All Heritage Health Adult members will join one of the 3 health plans in the Heritage Health program. These health plans coordinate and reimburse health services the member receives. How this works, generally speaking, is that the state pays a per member per month rate to the health plans or the managed care organizations, and these health plans are the ones who actually pay the doctor's office or the pharmacy for the services that they provide, just as a couple of examples. When someone is enrolled with Medicaid, they are assigned to a health plan. Once enrolled in a health plan, members will receive an enrollment notice saying which plan they are enrolled with, followed by a welcome packet from their health plan with details on how to begin using their benefits. Member choice is a big part of the Heritage Health program. So, if someone wants to change their health plan, they have different opportunities to do so. Members can change their health plan at any time during the first 90 days they're on Medicaid, and they can also change their health plan during open enrollment each year, which is from November 1st to December 15th. Just to note, open enrollment in this context only is about changing health plans after you are already on Medicaid. It's not about when you can apply for Medicaid. You can apply for Medicaid at any point throughout the year. Many people eligible for expansion will have various health needs that may be a barrier to improving their health in the long term. For these individuals, DHHS will be able to determine them medically frail, which will make them eligible for Prime benefits. Medically frail is a new topic that only applies to the expansion group. You also must be determined eligible for Medicaid before a medically frail determination can be made. Though medically frail only applies to the expansion group, anyone covered through expansion who has basic benefits can request a review from DHHS for medically frail status. Members' health plans can help their members navigate the medically frail process, which will often include making sure the right information is sent to DHHS for the department to make this review. DHHS will let everyone who requests a medically frail review know of the department's decision, regardless of the outcome. These designations are good for 1 or 3 years, depending on the health diagnosis, as some health conditions lead to more long-term health effects than others. This designation, for medically frail, can be reviewed once again at the end of these time periods. This slide includes an example of the notice someone will receive if they request a medically frail review. The notice includes DHHS's decision, the benefits that are included, and the effective dates of this decision. Here are a number of different general examples of the types of diagnoses or health conditions that can lead to a medically frail determination. Some of these examples include certain mental health conditions, substance use disorder, different types of disabilities, and various serious and complex medical conditions. Also worth noting, although it isn't a health condition, is that people experiencing homelessness will also qualify for medically frail, even if they don't have any of these different health conditions. More details, including more particular health conditions, are available on the DHHS website. Nearing the end of our presentation, we would like to remind Medicaid providers of some of these responsibilities that are included with serving Medicaid patients. Providers are required to check patient eligibility prior to providing services. This will be especially important as some Heritage Health adult members will have their Medicaid cards in hand prior to when coverage begins on October 1st. Providers will also need to verify whether their patient has dental, vision, and over-the-counter medication benefits. Please visit the DHHS website for more details on how to verify eligibility and benefits. Providers can use the same tools to verify both of these details. Providers will also be asked from time to time to provide information to assist with the medically frail process. This will most commonly take the shape of completing a provider attestation form that providers can use to attest to the fact that their patient has a particular health condition. As with providing services, providers should verify their patient is Medicaid eligible before completing this form. The provider will complete this form and send it to DHHS. Informational materials on expansion, like an FAQ, fact sheet, and flyers, are available on the DHHS website at dhhs.ne.gov/Medicaid expansion. And this concludes our presentation on Medicaid expansion. Thank you for listening. If you have any questions, please contact us at the email address in front of you.